The coronavirus pandemic caused a dramatic increase in hospital costs. Analysts with Quote Wizard found that in California alone, hospitals sent 10% more per patient in the beginning of the pandemic than they did in all of 2019. California ranking in the top 5 of states with highest hospital expenses. Joining us now to take a closer look at the data and what's driving the increase is Nick Van Zandt. He is the senior insurance analyst with Quote Wizard. Nick, good morning. Let's start here. So this trend extends even further past the pandemic. Why do you think we're continuing to see this increase in hospital care costs even now?
You know, we have seen medical costs rise really for the last decade and more. When we look at it, hospital expenses have risen 23% nationwide since 2016, 9% in the last statistically available year, which is the first year of the pandemic. But when we look going all the way back to 2011, we have seen about a 50% increase in the amount that hospitals are paying. And ultimately, it's not a direct comparison, but ultimately, this does have an impact on how much you are paying for your health insurance, where we have seen a 17% increase since 2016 in how much people are paying for health insurance. And when we look at all of these hospital expenses, the big question is, we know what the hospital expenses are now. How much is this going to affect people's health insurance moving forward? We have already seen some preliminary data from 2022 showing that health insurance premiums have risen by as much as 23% in some states.
Nick, we have some graphics that we want to show our viewers as you're kind of breaking some of this data down, but explain why that's the case. So we talked about the hospital expenses going up for people with health insurance, but why is that? What is it that's ultimately fueling that rise?
You know, when we looked at it specifically in the first year of the pandemic, a lot of it was based around labor. There was a 20% increase in the cost that hospitals had to pay for labor. And basically that is because during that first year of the pandemic, there was a lot more medical staff that was needed and there was a lot less medical staff that was unavailable. I think the reason that we have seen such a big increase in the last year is because a number of factors all worked together or against each other, however you kind of want to look at this. But basically what we saw is a massive increase in the number of people who needed medical care, a shortage in the number of people who were able to provide it. And then at the same time, at the very beginning of the pandemic, we had record unemployment. Health insurance is largely tied to employment. So you basically had a situation where we needed more people, had to pay more for them, and at the same time, also had a large number of people that did not have health insurance coming into the medical system.
And Nick, we have about 20 seconds here, but help our viewers understand just what the future holds. I mean, you already talked about it going up a bit already this year. What can we expect coming very soon?
I think that we've all gotten used to the idea that prices are going to go up and continue to go up. I think that people should be prepared, though, for some big increases in their health insurance premiums. And because of that, really look at what's involved and really look at the different options that are available to you. And a health savings account can really help you out.
All right, Nick, thanks so much for being with us this morning. A lot of great information for our viewers.